Every 5 minutes, it claims the life of a child in Tanzania, Africa. It's responsible for the deaths of more than 3,000 children each day under the age of 5 and claims the lives of nearly 20% of pregnant women each year in the region. Malaria is an infectious disease spread by the bite of a mosquito. In rural villages of Tanzania, pregnant women and young children are most vulnerable.
Pregnant women and small children are most vulnerable to malaria for the mere fact that just being pregnant is a stressor to a woman's body. But being in an area where they don't have the resources, they can't get prenatal care, they cannot get prenatal vitamins, they don't have the right nutrition, therefore their immune systems are not 100%. So therefore when they get malaria, their case is going to be more severe, causing deaths. Same thing with children. Their immune system is not fully developed, so when they get malaria, the cases are much more severe. The fevers, and they get encephalopathy, which is a swelling of the brain, meningitis, and they die.
On the coast of the Indian Ocean, in one of Africa's most beautiful and diverse locales, Tanzania is in the midst of a growing malaria epidemic. Although the use of a mosquito net has been proven as a reliable barrier to protecting against the deadly disease, malaria is still the #1 killer of young children in the area. Medical experts say education is the key to putting an end to this fatal disease.
The key to preventing malaria in Tanzania is education, education, education. Very important. These mothers don't know what malaria is. They don't know the signs, the symptoms. They don't know the difference between bacterial infection and viral infection. They don't even know how to use a net. They lack the resources. Some of them can't even read because most of them have not gone to school. So education is the key to preventing further outbreaks of malaria.
While the death toll is still very high for malaria, adult deaths due to the HIV/AIDS crisis are just as high, resulting in millions of orphans and abandoned babies.
There are many orphans today in Tanzania because of the HIV/AIDS epidemic and also because of malaria. These two diseases leave children without parents. They have no one to care for them. They have no place to sleep at night. So they can't put a net over a bed because they don't even have a bed. They have no food, no shelter, no one to care for them, no one to take them to a doctor. So even if they have a fever, they don't know what to do. So we have children that end up on the streets. They're just left without anything.
But there is hope. There are simple ways to provide relief and help the people of Tanzania. CHaRA, a U.S.-based nonprofit organization created in 2006, is dedicated to teaching Tanzanians about basic health care. Concentrating on malaria prevention, the education aims to lower infant mortality rates, giving children and their mothers the chance to lead healthy lives.
We go in and teach them what malaria actually is, what the symptoms are, when to go to the doctor, when to be tested, what medicines to take, and then we also provide them with a net, showing them how to use the net, because if used improperly, it's not going to do the job. Showing them how it has to cover the whole bed, be tucked in, so the mosquitoes can't get through.
So at the same time, we do seminars on basic hygiene, diarrhea causes, and how they can do hand washing to prevent those illnesses, and we do a midwife training on birthing of babies in the rural village areas.
I was fortunate in having the opportunity to go with the CHaRA team into the field to visit a village and participate in their clinic to provide health care to children. And I was really impressed by the dedication of the CHaRA team, the CHaRA folks, and I think it's a wonderful program. I think that it's refreshing to see an activity that is focused on giving something directly to the people in greatest need.
While malaria eradication is a top priority, additional efforts are needed to protect orphans and provide them with an opportunity for a better future. CHaRA has plans to create a safe place, a refuge that will provide for all their needs, such as food, clean water, shelter, education, and above all, hope.
Our plan right now is to build a refuge. It will have a center building where they'll go in for food, and they'll have showers and toilets available to the kids. And then around the outside will be their dorm rooms, and we'll have a dorm mother and people to come in and teach and train the kids and love on them. But mainly it will be a place of safety and protection for these children.
CHaRA focuses on the needs of children and communities in rural villages in East Africa, where resources are limited and hope is deferred. The vision of the faith-based organization is to see the bonds of poverty broken, children enjoying good health, and an end to malaria-related deaths.
My job is to first go into a village that we've recognized that needs the treatment. They all need treatment, but we work with the local government leaders, and then they go door to door in the village, alerting the mothers that there's going to be a clinic held in the village on a certain day. And so when we arrive, we get word that the mothers have come before the sun rises, and they wait patiently all day. We'll have 400 to 500 in one day, and they wait patiently to get their turn, to get a free bed net, and to have their babies inspected from head to toe. We have a pharmacy on site. It's all free. All the meds, everything is free, taking care of the mother and the babies. My whole goal is that every mother in the world wants a healthy baby. And my satisfaction at the end of the day of that clinic is to see the mother smile. She goes away smiling that her baby is cared for, and the word spreads. And at the end of the day, the local village leaders will say, "When are you coming back?"
One of the best things about CHaRA and what we do is that we get to have a story to tell about a child. A little baby came into our clinic. A grandmother brought her in. She was 8 months old, and she was dying from malaria. And because of our clinic, we were able to treat her, get her to a hospital, take care of her needs. Today, she's 4 years old. Today, she can go to school because we were there, because we intervened. Otherwise, she would be dead today.
Malaria is a deadly disease, but through CHaRA's life-changing outreach and educational programs, the people suffering in Tanzania now have a glimmer of hope. Your charitable contributions will make a difference and help save a life, so that one day the plight of malaria will be no more.
I think by donating, you actually can make a big difference, even if it's $5. Because $5, a whole family sleeps under a net. And believe it or not, the mothers are scared to death. Every night, they're in fear because the mosquitoes just fly in by, they predict it's about 100 mosquitoes per hut per night that are in there biting. And they have absolutely no defense.
Have you ever saved a life? Have you ever impacted a person's life? That's what CHaRA does. $5 will allow us to give a net to save a whole family. The net fits over the whole family. Just to provide a service for them.
To make a donation or to find out more about CHaRA Mission's humanitarian projects, visit charamission.org or call 800-753-0626. It is more blessed to give than to receive.